Today's podcast is brought to you by Cascade Health Alliance. Hi, Jennifer. Can you give us a little background about yourself and your journey in healthcare leading to your current role at Klamath Community College?
I can. Again, it started when my mom was a nurse in Arizona. I realized that healthcare allows us all opportunities, and I knew that I didn't like body fluids, so I went into the medical records, and then I moved up here after I graduated from school. And I will tell you, and I tell my students, that it's not the easiest organization to get into because there's only one hospital. But once you get into it, it's a great opportunity. And so I worked in medical records, quality management, trauma registry, all of the aspects that then led me to an opportunity at Klamath Community College, where that's what I do. It's the HIM, Health Information Management Program, and I teach. I have the credentials, I have the education, I have the experience, so I teach what I know. And that's how I got to KCC. Dr. Gutierrez allowed me to grow the program. I'm now applying for third-party accreditation so that we can have RHIT, so we can have the students sit for Registered Health Information Technician.
Can you talk more about the third-party accreditation?
I can. What do you want to know other than it's a lot of work, but they require competencies. All of this mirrors what you're teaching, the competencies, the exams, the testing. They'll come in, it's just like Joint Commission. They'll come in and do an evaluation to make sure that we are doing what we say we're doing and the students are getting the education that they need. I have to do self-study for myself and to make sure that the students are doing what they need to do so that they're ready for the exam. And so we can house the exam at Klamath Community College because we have a Pearson's testing center. So we're meeting all the qualifications that KM requires so that we can get more RHIT, Registered Health Information Technicians, out into the community.
There's workforce shortage in the healthcare sector, especially in the HIM arena. Can you talk to the partnership between KCC and Cascade Health Alliance?
So our partnership started 4 or 5 years ago when you approached Dr. Gutierrez and said, hey, do you have somebody that I can talk to? I don't know exactly how it went, but so you and I met. And then it took us a couple of years to get the students here, but the students arrived. You hired 2 of them right after their 99 hours of work experience. And then one actually did an interview with you. And then 2 other ones got hired, 2 other HIM students from KCC got hired as well. So the partnership is growing. I think as we move into the Registered Health Information Technician, I think there will be an opportunity for even more growth. At one time you said you needed medical coders. And I was like, okay, those are a special breed and we're working on that. And I think we've met that. I've got the instructor, she's doing a great job. So I think this year coming up in the summer, there'll be a few at your door. And I think our partnership will continue to grow.
What accomplishment are you most proud of?
My students being successful, my students graduating and getting employment. Doing their 99 hours of work experience allows them to have some hands-on. Like I provide as much hands-on training as I can throughout the program with the software that I use, but then they go out and they market themselves. They showcase who they are and what they've learned. And organizations like you hire them, that makes me happy.
And for students looking at a career in the HIM world, what will you tell them to focus on?
What to tell them to focus on is what they want to do. Do you want to code? Do you want to do analytics? Do you want to do registries? There's so much out there that's available for them to do. You can go any direction. A lot of people go into coding or go into informatics and realize that, I'd rather look more at the quality. I'd rather look more at how patients are being treated than actually coding. But we need the codes so that we can pull the records to do the analysis and the investigative work.
Got it. And can you share any success stories or examples of how students who have participated in our partnership have excelled in their studies or in their careers?
So I've already kind of leaned towards that. I've named a couple of them. I wanted to also share that there was a 70-year-old lady, Lila. Do you remember Lila? Yes.
Layla, amazing.
She was amazing. She went back to school. She got her associate degree in health information management and her coding specialist certificate, and came and worked for you and worked for another 10 years. So it was amazing. And then there's 4 other ones, younger ones, that are here.
And for a high school student or anyone looking at this career, where do you see the future of the HIM industry going, and where do you feel like there's opportunity? Obviously, we're always open for business. From your perspective, where do you see where there are other opportunities?
So for high schoolers, I've made a number of certificates that they can work in electronic health records, because that EHR is a huge technology, and so I've worked in that. I've worked with the high school, local high school, so that they can get their certificate in that, and then they can also get a billing and coding specialist certificate, so they can work on their certificates. But as they're working on their certificates, they're also building the foundation for their associate's degree, so that they can go, once they have this, they can go anywhere in the nation to get a job. We want to partner with the hospital, with you, with Open Door, so that we can keep people here. And I know that I've been talking with Michael, and we're doing I think there's conversation about a paid internship, and so that will also improve our partnership.